Good morning, sir.
Good morning.
Good morning.
I did one more automation. So when I say Om Namah Shivaya, so at that time my puja room light will be on, and there are few diya type of lights, so they'll start blinking. I can even say fine tune it, plus did some of the other things.
Good morning, sir.
Good morning. Those mistries, those who are working, they were laughing. They said, I just before few minutes, this thing came. This is that tape, that professional tape. They said even we don't use these quality of tapes. Because in next 2 days, the planning is for those profile lights. The margin which they take, that is so high. You'll be surprised that for say 20 feet of lighting, it costed me 1,000 rupees. You know the cost which they take? So this is for 20 feet. What they charge is 200 rupees running feet per feet. So this much would be costing, instead of 1,000, it would be costing 4,000 if they do it. And over here, we don't know about the material which they'll be using. Here I used all in all Philips, the best of the best. And and one more thing, I'll be able to automate it. They said this automation part, kuch nahi, whatever the color which you select, fix ek color rahega. Over here, I'll be able to change any of the color from 16.7 million color, any of the combination.
Good morning, sir.
Good morning.
Good morning, sir.
Good morning. Yesterday evening, say, tell me what you are writing is, but yesterday I did a huge blunder. So what happened is, I created a routine that the paneer sandwich should get ready by itself, and so that I fixed the on timer, everything was set, and it started working. I missed when it should be switched off, right? So this was one fault. And second, the temperature sensor, which was over here, so it has to be in centigrade, right? I put it into Fahrenheit. So that unit was, I missed to change the unit. जब वो जलने की स्मेल आई, तब पता चला कि रूटीन में कहाँ फर्क आया. Fully burnt, मतलब black. Now my kitchen is bit far from this computer room, पर यहाँ तक स्मेल आई थी.
Good
वो तो
morning.
आप लोगों ने भी कभी ना कभी ऐसा किया होगा ना.
Yes.
हाँ.
Yes, sir.
Yes, sir.
हाँ, गलती करके सीखते. Cost of automation, this much professionally, if you try to, it would cost more than maybe 3 lakhs. Till this point of time, I have spent 20,000. The main part is the programming part. That is when you convert it into text to speech engine. Then there is a bridge engine. Then Alexa developer site. That is where you have to really keep. Then there is Perplexity, which is our AI, right? Perplexity. And then you have to integrate with the bot. Okay. Chalo. So we are beginning with upper limb, right? And as I said last time, that will be going pretty fast. And I'm taking it for granted that you have already seen this video from the YouTube. In case if you have not seen it, no worries. For today, you don't have to worry much. We'll be going at that pace where if you have learned it, well and good, it would be a sort of revision. If you have not learned it, still you'll be understanding the concept, and you'll also be understanding that this is the way how we'll be learning the entire anatomy. The concept of what's called as the spaced revision, right? Spaced revision. Spaced revision is that very few of us are Vivekananda. You read it once and you remember it forever. At least not me. That's the reason that we need to revise it very properly. But there is a pattern, right? What people do is they आज एक topic पढ़ा, कल दूसरा topic पढ़ा, परसों तीसरा topic पढ़ा. एक week के बाद suddenly if someone asks कि अच्छा tell me about pectoral region, and then you feel कि बस कुछ भी नहीं याद. Or very basic thing. Why it happens? Because this is a normal tendency. When we'll be learning brain, we'll see it in detail that what exactly forms the memory. But in simple words, memory is nothing but these are the protein chains, right? Protein chains. Now, these protein chains, they are divided into that for how long these protein chains can remain stable before they start disintegrating. Now, this disintegration process, it depends totally upon your emotions, the limbic system, right? The way, if I say just, okay, close your eyes, and have you encountered any accident, right? And then with what clarity you will be telling, अरे सर मेरी तो गलती नहीं थी, because अपनी तो गलती कभी होती नहीं है, right? वो सामने वाला जो था उसको ही ड्राइविंग नहीं आता था and उसने आके सीधा मुझे मारा. And then you will be telling that thing in explicit detail, complete detail, है ना? पर यही पूछा कि यार परसों खाना क्या खाया था? No, we don't remember it. Because it was not registered. But then if a question is asked, just tell me that last time you visited any of your friend's birthday, वहां पे क्या था? That we remember. Because it was associated with your emotions. So anything, if it is associated with emotions, you don't have to struggle. You remember it automatically. That's the reason when you love your subject, you'll be able to remember it very easily. Right? But a simple logic, if you love your subject. So the moment anatomy becomes your girlfriend or boyfriend, and it happens, na? You are talking with your girlfriend or boyfriend, 1 घंटे तक बात किए, लगता है कि यार अभी तो आई, right? And then if you watch the time, then you realize कि अरे बाप रे इतनी देर हो गई. पढ़ने बैठे हैं, आधा घंटा हुआ नहीं, अरे यार आज तो बहुत पढ़ लिया, राइट? पूरा लीवर का राइट लोब पढ़ लिया. We feel so that's the theory of relativity. अब आइंस्टाइन ने कुछ अलग अंदाज में कहा था, but this is what we really feel, that time is a relative factor. But if we start loving anything, so then it becomes easy. So that's the reason that all these subjects, once they become your part, it becomes a pleasure. So here, today you'll realize that many times some important concepts will automatically be revised, right? This is the memory chart. If you follow this pattern, you'll be able to remember it. It follows number 3.
Sir,
हाँ बोलो.
sir, actually I'm traveling, so can I record the lecture?
Surely. और
Thank you, sir.
बेटा ऐसा तो आप रिकॉर्ड नहीं करोगे ना तो भी चलेगा, because this entire lecture is on YouTube, right? Here तो we will be going very fast. If you have not
Okay,
seen the
sir.
YouTube, I would really advise you, or I will recommend that you see that lecture. Definitely आप देखो, right? Because ये initial 4-5 lecture है ना, they are very important to build up your concept. यहाँ पे will be going bit fast, unless if someone tells कि नहीं अभी इतना fast नहीं, तो then we'll slow down, but otherwise नहीं, we'll be going pretty fast. वहां पे things are at a very slow pace because I really wanted to build up the concept. अच्छा,
Oh,
इधर
sir, also, good morning. But I
oh,
joined very late. I joined Vishwa only very late. So I got to know about these lectures like abhi only. This is my first lecture. I
okay,
can view other lectures on YouTube, right?
yes,
मतलब problem नहीं होगा ना?
बिल्कुल नहीं, बिल्कुल नहीं. और वेदिका, इनकेस अगर जो कुछ भी प्रॉब्लम है तो just let me know, because you are not alone. There are even other students also, those who have joined bit late. So what I was thinking is that normally we don't meet on Sundays.
Okay.
So we can even plan to meet this. So that would be the fourth lecture. We are meeting on every Tuesday, Thursday, and Saturdays, but we can even schedule one of the lectures on Sunday. Now on Sunday, we'll be taking those topics which are like common topics and where people have found it difficult, right? Or they have missed those lectures. So on Sunday, it would be like a comprehensive thing. So we can surely do that. Right?
Okay, sir, that would be amazing. Thank you.
One more thing, because it is your first lecture, do you have the email address on which you are supposed to communicate with me for any of the trouble?
No, no, I do
Okay,
not.
no worries. Just jot it down. It is TILLURMBBS. So it is like till you are MBBS at gmail.com. So when you will be sending a mail to me, I'll send you the link. So on that link, that is a Google Drive link where all the PDFs are there. So this will give you the guide that what lectures were performed in what sequence. So accordingly, you can even watch it from the YouTube also. And the PDFs are also there. And in case of any trouble, just let me know.
Okay, sir, thank you. I will email you today.
Sure, sure. And one more thing, say for upper limb, right? Even if someone has not joined, I have not seen any of the lectures, previous lectures, no worries. From this point onwards, this is absolutely a fresh region. You'll be able to understand everything. All right.
Okay, thank you. Yes.
Okay. So this is what I was telling, the memory, right? First, it is the trouble only in the initial phase. This is zero. Zero means we are studying or learning anything right now. If we don't revise it within 3 hours, you start losing almost 30 to 40% of the substance within first 3 hours. Now we never do that, right? We go to library, ek topic padha, dusra padha, and until night we study. And then once we go back to the hostel and someone asks, kya padha aaj? Are subah cirrhosis of liver. हाँ चल मुझे समझा दे. And we find कि यार, am I so dumb? पता ही नहीं चलता, याद ही नहीं आ रहा. Then we open the books and then we say, I missed this. That's the reason that in all of our lectures, I'll be taking care of this part. First 3 hours. So by the time when we study any of the new concept, within very short time, right, within few minutes, we'll revise it. So this first revision is complete because after first revision is complete, the next revision is that you have to revise within 3 days. 3 days. Now this is like a secret. For 3 days, you have got now 3 days. Within 3 days, you just go through that PDF at a high pace. You don't have to worry about that going at a very slow pace and word by word, line by line. No, fatafat, just let it go through. And this PDF will be consisting of those images on every page. Every page. This will be the pattern which will be following whether we are learning anatomy, physiology, pharmacology, pathology, everywhere. When we'll be studying pharmacology, it might happen like, say, when we are discussing side effects. So then it might be 1, 2, 3, 4. But on one page, there won't be any time, there won't be more than 4 lines, maximum 4 lines. And everywhere it will be like handwritten thing. Because when things are handwritten, I can say that, okay, focus on this, right? Focus on this. We can change the color. PowerPoint is okay, but it's handwritten for this particular purpose because it creates a specific effect on the brain and you remember it easily, right? So this is 3 days. Now comes your part. Within 3 days, you have to revise. What time? So we utilize the best of the time, and best of the time is before sleep. Before sleep. Before you go to sleep, how much time? 10 minutes maximum. So you mean to say that 1.5 hour of lecture to be revised in 10 minutes? Yes, because you won't be requiring even 10 minutes. Within 3-4 minutes, you'll be able to scroll the things at a very high pace and you'll remember it. Because रात को सोने से पहले, if we listen to any of the song, if we watch any of the movie, so then we are part of that movie for the entire night. सपने भी ऐसे आते हैं, right? So this is one. And as soon as you wake up in the morning, as you wake up, revise again. So again, 10 minutes max. I learned this thing in a very hard way. That I made a radio when I was in MBBS, first MBBS, I made a radio. So subah hui, and as soon as I joined those wires, and radio would start. Invariably, the advertisement of Nirma used to come. Washing powder Nirma, doodh ki safedi, ye this, that. Right? I can sing the whole song. But that Nirma se aayat, but then when I was, it's like when I was sitting in library, when I was playing table tennis, washing powder Nirma, right? It used to happen like that. For no reason. For no reason. I was the agent of that Karsan Bhai Patel, right? He was the owner of Nirma. And it used to happen, yes. So that's the reason that we'll be doing this, because in our brain, then these things will keep on getting rotated, and it is a sort of wonderful revision. Once you have done this, after that, you have to revise within 3 weeks. Now the journey is very easy, right? The next revision should be within 3 weeks. And after that, you are the boss. 3 months. And then just before exam, go through it. Before exam, at a very high pace, at your ease, gaane wane chal rahe hain, no problem, music chal raha hai, no problem. Because these things are now, it has already been converted into the permanent protein chain. And that's the secret that you always remember. And beyond that, it is once in 3 years. So if on your birthday, right, this is a very long term, but your birthday, it is special. So on that day, what you'll be revising, you have already planned that. You will be revising those things which you have learned in the entire year. So there is a specific folder, and you just click on that file, just go through it, and there'll be aha factor. Yes. Aisa hua tha, ye padhe the. Right? All those things. So your birthday automatically becomes so special. So this is how birthday is to be celebrated, not by cutting the cake. क्योंकि cake क्या है, right? Those who have joined for the first time, दिल से कि ये क्या बात हो रही है. हाँ, but cake तो अपने उसको ही खिलाते हैं कि साले तुम मर जा, right? मत जिंदा रहे. I hate you from the deepest of my heart, right? दुनिया के लिए तू भार है, right? पृथ्वी का बोझ हल्का हो जाएगा. Obviously, na, because you are giving that person maida and sugar, right? So उसको heart disease हो, liver disease हो, all those things, and खुशी खुशी उसके मुंह में ठूस रहे हैं, खा. क्यों? Right? This is in reality. हाँ, आप में से किसी ने पूछा था कि सर आप बर्थडे को क्या करते हैं? नेवर ईट केक. किसी के बर्थडे में जाता हूँ तो भी बिंदास मना कर देते हैं. क्यों? Why to eat? पनीर became कोयला. हाँ, अरे बस that's a word. वो कोयला ही था. चलो. Now we start. So here it is. That's our beautiful skull, but we are supposed to talk about the upper limb. So this is the first bone, that is the clavicle, the only horizontal bone. Rest of this is a long bone, right? It is a long bone. So we say long bone, why? Because it has got that tube-like shaft, and then there are 2 ends, right? So even digits, they are also long bone, but they are very small, but they come under long bone.
Sir, digits can be miniature.
Ha. So this is the long bone, which is horizontal, right? It is a transverse, right? That's why horizontal or the transverse. The idea is to keep arm away. Now there is a condition called cleidocranial dysostosis. Ostosis is formation of the bones, right? This means improper formation of the bone. Cleidocranial. So this is about the clavicle. It is this condition. This is a congenital condition. That is when the bones are not formed properly. Right? There are many other things also associated with it. But with reference to our today's session, this clavicle, that is not formed properly. So that's why it would happen like as if both the arms, they are coming from the front. Right? This tells us that function of clavicle is to keep arm on side. right? So that's why it keeps the arms on the side. This is a condition, right? On to this next one. This is a palpable. Palpable means you can feel it. Now, this point is very important in the entire body. This is from the clinical point of view. If you can palpate a bone, that means it is giving you a reference. It is giving you a reference that which structure, which are the areas which are above, which are the area which are below, which are the areas which are lateral, which are the areas which are medial. So it is giving you the complete idea. So even aankh band karke bhi, right? There is a track of gall and burdock, very nice track into your spine. You are using that track of gall and burdock by closing your eyes and then feeling ki haan, yahan pe there is a bone, right? So this is what is called as the palpable. Important is today at the end, I'll be teaching you even a coacher's method. And at that point, I'll tell you that you have to really perform it. When you perform, you'll find that there would be pain in specific areas. So that is where it will teach you our next session, right? That is when we'll be learning about more in the detail about those muscle stabilizers. Anyway, so palpable means you feel, so that your fingertips, they know. Can you take the pulse? Can you feel the pulse by yourself on the wrist? If yes, good. Your fingers now, this is the most sensitive area. And for every doctor, the more you palpate, the more you feel, your fingers become more and more sensitive because your brain will start registering it. Yes, this is the type of sensation. Brain is like a clean slate. Brain is not understanding that what is happening. If it's like a wonderful car which is passing, right? You'll say, huh, it's a good car. That's it. But if you really know that this is some special car, this is like, say, Mahindra's, say, 9 EV, right? So now you will know that this is a car which has got this much big panel, which has got the capacity, it can drive on one charge, it can go to about 450 kilometers, because your brain is knowing. So that's why you watch it with care. Same thing is even for the patients, right? So for patients, never doubt on yourself. You'll be, as you have sent the mail, that will it be possible to remember so much? Absolutely, without any trouble. Once you understand it, it will become very easy, right? So don't worry at all. But yes, this is what you will feel, right? So palpable means you just, as we discuss, even you can palpate by yourself. Haan, yahan se, yes, you can feel the entire bone, right? So that is palpable. It is subcutaneous. That's the reason it is palpable. It is just underneath the skin. Sub is under, right? Under. And cutaneous means skin. So this is just under the skin. So if the skin is removed, immediately you'll be in contact with the clavicle, right? So that's the specialty of this particular bone. And it is a S-shaped bone. Lagta to nahi hai, right? It looks straight. We say it is S-shaped. Yes, S-shaped when we watch it from the top. When we watch it from the top, this is big. This is the beginning. This is the end. Well, it is S-shaped, right? When we watch it from the top. So this gives us one more idea. In geometry, when anything is S-shaped, not geometry, but in the architects, wherever there is change in the curvature, it becomes the weakest point, right? So this is the point. This is the point where there is a change in the curvature. Now, what's the function of this clavicle? Clavicle, basically, when you lift the weight, or when you push the weight, or when the weight is getting transmitted on your hands, it will be transmitting, it has to get transmitted to the central axis, right? From central axis, it goes to all the way, sorry. It has to be transmitted all the way down, right, onto the ground, and then via feet, it is transmitted to the earth. So things lifted with hand, it has to be transmitted to the ground. Clavicle is responsible. So that's the reason clavicle is a weight-bearing bone, horizontal weight-bearing bone. So if the fracture is to occur, this is the commonest site, right? This is Vedika, no? Vedika, this is hash, right? Not hashtag, this is fracture, right? So this
Okay.
is medical terminology for medical indicator of fracture.
Sir, lateral 1/3, right?
Huh?
Lateral 1/3.
Yes, exactly. So it is the junction of lateral 1/3 and the medial 2/3. This is the site, right? Lateral means which is on the side, medial is which is near to the center. Right? For those who are joined for the first time, just I'm quickly telling, right? So our central axis, this is median, midline, right? And this is which is away, it is the lateral one. So this is the junction, the change in the curvature. So it will break more over there. As such, if there is any direct injury, so it can break anywhere, right? Suppose किसी ने लाठी मारी, so that lathi it hits whatever the point at which it is hit, right? A bone will break at that point. Then the things are completely different. Say that will learn in forensic medicine. Patient comes, patient is trying to save someone. कह रहे साहब मुझे मैं गिर गया था. Right, and then you find that fracture is actually over here. It is a clear indication that it is a blow, direct hit at that point. So in forensics, because important is that when you are handling such cases, you might have to appear in the court. Right, court will call the doctor and will say, okay, tell us your opinion, and your opinion would matter in the final outcome of that case. That's the reason things are to be understood at a very granular level. याद रहने का प्रॉब्लम मत रखना, right? आपने मैसेज ईमेल किए थे. Don't doubt on yourself, right? You'll always be able to remember it. Okay. On to the next one. Here it is, a very quick recapitulation of the bones. This is a quick recap. There are major. This clavicle is now we know it. Know the clavicle. The another bone which is over here, it is called as the humerus. Right? It is the humerus. Humerus is the bone of your arm. Is the bone of your arm. In the previous lectures, right, we have discussed all these bones in detail. But still, I'll take care that thoda I'll keep on telling you. And this is the scapula. Scapula is the bone which is on the back side, right? So thus we are talking about three bones only. The scapula, this entire one is scapula, right? All this. This is a big bone, right? It is a flat bone which is on the back side. So when you touch your back, you'll be able to feel this bone, right? You'll be able to feel only one transverse ridge. The way anterior, you have got clavicle. On the posterior, you are feeling the scapula, but not the full scapula, a part of the scapula.
Spinous
Okay.
process.
That's right. It is called as the spinous process. Chalo, dekh hi lo. Right. आएगा. Chalo, I think it is further आगे है. But trust me, right? That is a part of scapula. So this clavicle has to join this scapula. So this is the joint which we are talking about, right? So this is the clavicle and this is the part of the scapula. This part of the scapula, this is the extension, as if this is scapula is a triangular bone and then there is extension, and that is called as the acromion process. You have to remember all these names. That's true, right? You have to remember it. Yes, you have to remember it. Right? So this is the acromion process. So acromion and clavicle. So this is real picture. Right? This is a real image. This is how it will look like. All these bones are real. Others, they were the graphics. So these are real. We'll keep on comparing both of them. More interesting when we'll be learning the thorax. Right? In thorax, when you'll find in graphics, the heart looks so beautiful. Right? You fall in love. When you really watch it, you feel dangerous. Kya re baap re. Is it so dangerous? Yes. So here is, right? So this is the joint, and we'll name this joint. The naming is easy: acromion process and the clavicular. So we'll name this joint as acromioclavicular joint here. Right? We just write it acromioclavicular, right? Clavicular joint. Why such names? These names in anatomy, every point is defined in such a way that even if you close your eyes, you should be able to locate that where exactly it is. because your reports, they will be written in the form of text, right? Not in the form of graphics. So if you say that there is fracture near the left acromioclavicular process, so then it visualize that where exactly it is, right? And this is a lateral part. So you trace all the way, and then you find that's the point. That's the point where there must be the fracture. Okay. Next, this is about the medial end. So where it is connected centrally. So there is this depression, right? This depression, it is here, right? It is here. And here, when we'll study the organs, this is where the trachea is there. इसलिए किसी को गला दबा के, because I'm not training you for that, but this is the point that doctors, they can murder someone much easily. वो movies में दिखाते हैं गला दबाना, they ऊपर से दबाते हैं, right? Very simple. Press from this point, right? Because the trachea is so superficial that even a slight pressure will block the trachea. Person will die much faster. Right? So that's why doctors, they should be, the movies में दिखाते हैं कि यार डॉक्टर है, खतरनाक है, होना ही चाहिए ना. So this is the place, right? So this is the medial end. So that's the medial end, and that is connected to the manubrium. Manubrium, this is sternum. So this is what is also called as the breastbone, right? So over here, this is the bone which is in center, right? And when there is, last time when we saw those x-rays, this is where with the drill, right? Right, it is cut, and then the chest is open. So all open surgeries, right? Cardiac surgeries, which are like open cardiac surgery. Literally, this bone is split, and then the jaws, they are adjusted, and then you rotate, and then it will open the whole chest, right? And that's where you see the lungs, and then you see the heart, and then the procedure starts. Now, this bone is so powerful, surgery is complete, then it is put back. Now, by putting back those normal sutures, so वो तो एक second में टूट जाए. That's why they go for what's called as the metallic suture, right? These are the metal wires. So these metal wires with the machine drilled and then the tied, drilled, then the tied. So that's why you see those metallic sutures in X-ray, right? All those metallic sutures you were seeking, that there was, if you notice, so there was a wire and then वहाँ पे एक गांठ लगी होगी.
Yes.
Right? So these were the metallic sutures. So that's the bone, because this is the bone which is into the center. Manubrium and sternum. Okay. Now this level, now we come to this level. So this is a level where this sternum, as such, it is divided into two parts and three parts: manubrium, sternum, and then there is one more area which is over here, and it is called as the xiphoid process. Xiphoid process. It is a very small process, but its importance is quite. So this level, it is crucial. This is the level which you should be able to feel even in your body. So from here, start traveling below, and then immediately you'll be able to feel the horizontal ridge, right? Horizontal ridge. That ridge, that is called as the angle of Louis, right? This is angle of Louis. It is also called as, very conveniently, manubrio-sternal junction, right? The junction between manubrium and sternum. So manubrio-sternal junction. But this gentleman must have identified it for the first time. So angle of Louis, right? Why this angle of Louis is important? Because so many normal anatomical changes, they occur at this point, right? So this angle of Louis, the trachea, when it comes from the top, right? Trachea, our breathing pipe, and it divides. At what level it divides? It divides at this level, angle of Louis, right? So that's the trachea. So it divides at that level. We know about the aorta, right? Aorta. So aorta is the biggest chamber. If you consider that this is our heart, right? So this is our left atrium. This is the left ventricle. From left ventricle, the aorta goes out, the biggest artery of the body. But this aorta, it goes into this fashion, right? It goes like this. So the component which is over here, It is called as the ascending aorta because it is going up. Then there is arch of aorta, arch because it is taking a turn, right? No big rocket science. And then there is a descending aorta because it is going down, right? It is going down. This particular level, right? This level, that is the point from where we'll say ascending aorta has ended and now it is arch of aorta. Now this arch of aorta, it has ended and now onwards we'll be calling it a descending aorta. It is at, once again, angle of Louis. Right? It is at angle of Louis. Right. So that's the reason it is so important. Another important thing which you'll be watching visually and you'll be able to remember it, that second rib, right? All the ribs, they don't straight away go to manubrium sterna and then say, hello, boss. No, the ribs, they are only up to this point, and then there is a cartilage. And then there is a cartilage. Cartilage is a relatively soft structure, right? So that is like a glue between this particular rib and the bone. So this is a bone, and in between it is the cartilage. So it gives flexibility. It gives tremendous flexibility to the chest because chest has to really change its shape when you are breathing in, breathing out, right? When there is forced inspiration, or when there is forced expiration, right? So there will be major changes into that. Metallic sutures meant to be removed after some time, surely, but after pretty long time. Oh, ACL surgery in this young age. Okay. Don't worry, Samik. We'll just talk about it. Descending aorta starts from angle of Louis. That's right. So descending starts from here, ascending ends at that point, and arch of aorta starts and ends. That's right. So,
So,
huh?
does first rib also have some hyaline cartilage connected?
Yes. Right now, we are not talking about the type of cartilages, right? Just to
Okay.
avoid the confusion, but you are right. So this is, and even there are so many other things also occurring at the level of this angle of Louis. Right? But because this is first lecture, so that's why we are taking it a bit slow. So what other thing? Here it is. See, it is this second cartilage, second costal cartilage. We'll be calling it second costal cartilage. Costal means something which is related to our chest, right? So this is the second costal cartilage because that's the second rib. Two is written, second rib, and it's second costal cartilage. That is exactly at the manubriosternal junction. That is our angle of Louis. So this is another important point. This is the xiphoid process, which we already discussed, xiphoid process. And this is the epigastric fossa. It is also called as the epigastric fossa, the depression. That is the point when the chest, both the sides of the chest meet, right? In that fossa, this is the epigastric fossa. Just behind it, there is cardiac plexus. Right? There is cardiac plexus. And that's the reason that every female should know that in case of emergency, if you want to hit someone, never hit like this, right? If you just do what is called as the uppercut is your knuckle is extremely powerful. Now this is that point that even if someone who is very good in martial art, right, who has conditioned his body so much, but a minor injury, these are the weakest spot in the upper body. So this is the knuckle. If it is the uppercut, that is when your hand moves like this, right? And if it hits over here, the person would be unconscious immediately, right? Because it hits the cardiac plexus. When the cardiac plexus is hit, the heart will be into that contracted state for few seconds because that कहते हैं ना हो गया, right? So it is this.
Sir,
हाँ
sir,
हाँ बोलो
sir, isn't it कि the 11th and the 12th pair जो होता है rib का, it is the part of the rib?
Sorry, आपकी आवाज कट गई थी. Can you say it again?
Sir, I'm saying that isn't it that the 11th and the 12th part of the 11th and the 12th rib जो होता है वो सबसे weakest part होता है rib का.
Weakest is clear because it is connected at one end only. So ribs, they are divided. There are 12 ribs, right? Ab से फॉर एग्जाम्पल घर में सबसे वीक कौन होता है? एक फैमिली है, उसमें सबसे वीक कौन होता है?
सबसे छोटा
सबसे छोटा, राइट? वी से
सबसे
सबसे
छोटा
छोटा
से
बच्चा इज द वीकेस्ट, बट दैट सबसे छोटा बच्चा विल बी गिवन बेस्ट ऑफ द प्रोटेक्शन। कुछ होता है तो उसको कुछ नहीं होता। अरे बच्चा है, उसको तो पहले संभाल के रखो, राइट? वॉट एवर द अटैक विच मस्ट बी हैपनिंग, इट हैपन्स टू समवन हु इज एल्डर, राइट? वो कहता है मैं जाता हूँ लड़ने, वो छोटे बच्चे को नहीं भेजेंगे। सेम वे दिस 11th and 12th ribs, they are connected at one end. Technically they are weak, but nothing happens. उनका कभी फ्रैक्चर नहीं होता। It never gets fractured because they are so well protected from every side. And another thing, जो one who is rigid, right, it breaks. आप देखेंगे कि मतलब वो बड़े बड़े ट्रीज है, जब हवा आती है तो दे आर अपरूटेड, टूट जाते हैं। घास कभी नहीं टूटती। Which tree is powerful? Which one is powerful? Those trees are surely more powerful as compared to that ghas, right? These 11th and 12th rib, they are connected at one point. In case of it, there is, so they just bend and then they come back. Nothing happens.
Rebound.
हाँ, unless and until there is some stab injury, right? किसी ने छुरा मारा, तो that छुरा, if it is passing through that angle, तो फिर बात अलग हो गई, right? But as such, there are 12 pairs of ribs. So rib number 1 to 7, they are called as the true ribs. True ribs means they are both the ends, they are connected. So this is the posterior end which is connected to the vertebra, and anterior end by costal cartilage, they are connected to sternum, right? So vertebra to sternum, direct contact, right? Direct contact via costal cartilage, but they are talking directly. So they are called as the true ribs. Rib number 8, 9, and 10, that is 8 to 10, they are called as the false ribs. It is not so that they are made in China, right? So that's why they are false ribs. But the thing is that they will be connected to the costal cartilage of 7th, right? So they will be connected from vertebra to costal cartilage number 7. They will not be talking directly to sternum. And that's what gives the shape of the chest. While 11th and 12th, right, they are those bachas connected to vertebra only.
floating rib.
And that's why they are called as the floating ribs. Floating ribs. Okay. Here, one more important point. Simple. Clavicle लिया, clavicle का center point लिया, and line drop की. Right? This is what is called as the mid-clavicular line. Right? Nothing big, no big thing. Simple. Right? That line, when it goes all the way to the edge, so it would be reaching to the point, and that point is the tip of the 9th rib. The 9th rib, when it is coming from the back, so its tip. So this is the tip of the, you can also say anterior, right? Anterior tip of the 9th rib, or beginning of the 9th costal cartilage, because that is the point where the costal cartilage would start. Correct? So this is the tip of the 9th rib. So this is now lateral 1/3 and the medial 2/3, very weak spot. Yes, everything said and done. But palpate, and then you'll find that on the medial aspect, right, just underneath the clavicle, you have to palpate. You'll find that medial aspect is pretty full, right? But as you will go lateral, you'll find that there is khadda, and that khadda is called as the fossa. Now, those who are watching those Korean series, वगैरह, उसमें तो ऐसे ही दिखते हैं, right? They are so skinny. So that is those infraclavicular fossas, they are seen as such. So this is the exact location of infraclavicular fossa. Got it? Importance, yeah, importance is there. It will come.
Sure.
Now we are dealing with the muscles. Let's start with the first muscle. This is a major muscle, big muscle. That is the pectoralis major muscle. This is that muscle which is making the entire chest, right? So bigger the muscle, this is a huge muscle, and that's why it has got dual nerve supply. And it's a very smart muscle, right? So this is the pectoralis major. Now in nomenclature, whenever you come across this, that major, that means there is one other muscle which is like a pectoralis minor. Had the name been pectoralis superior, so there must be some other name, other muscle with the name pectoralis inferior. Correct? So ये हमेशा होगा. Always remember, though these points we have discussed in past, but because it is your first lecture, that's why do remember these some very golden principles of anatomy. Right? So it will make things remembering easy. Okay. So pectoralis major. So there is infraclavicular fossa. This is clavicle, correct? This is clavicle, right? So there is infraclavicular fossa. That is also clear. नीचे से पास हो रहा है. This is the pectoralis major, correct? Because this is the clavicle. यहाँ पे fossa, right? This is a muscle, huh? This is a muscle which is covering the entire thing. So right now, don't worry about it. So this is pectoralis major, and this muscle, this is the deltoid, right? Deltoid, which is giving curve to your shoulders, right? That is called as the deltoid. Now there are three parts of deltoid, not types, three parts of deltoid. बहुत easy है समझना. One which is anteriorly, second which is on the side, third which is on the back side, right? So we'll name is anterior fibers, posterior fibers, and these are the lateral fibers. Correct? These are the fibers. If you really want to improve your strength of your shoulder, being a doctor, you will be using आंख बंद करके you imagine which exercise is that which will be utilizing my anterior group of deltoid. So just put your hand on your deltoid and just move your hand up, and you'll find yes, it is contracting. You'll be able to feel the contraction, right? So this is one. Anterior deltoid is usually good. तकलीफ कहाँ होती है? Posterior deltoid में. Put the hand on the posterior deltoid and then try to move, and you'll find that ये movement तो it is much better when we take our hand back, when we take our hand back. So then we get that Brahma Gyan, कि जो gym के अंदर, that rowing, right? That rowing, why it is so important? Because when you cross 90 degree, it is that point when the posterior fibers of the deltoid, they are in action, right? Posterior fiber. So that is one. So this is anterior, that is posterior. And what about this? Logic tells, right? It's simply when we raise it sideways, yes, so that lateral fibers, they are contracting. So when you club your exercise it in such a way कि आज deltoid का दिन है, तो then all the three fibers. This is the difference between when a medical person is doing exercise and a non-medico is doing, right? Non-medico would say, today is my upper body day and posterior body day, right, etc. No, medico will say, no, I am focusing on these major muscles. During our exercise, we will not be going into World Bodybuilding Championship, but our major muscles, if they are strong, and if we can define the exercise in such a way so that compound exercise is happening, so that becomes more not only precise and perfect exercise, but at the same time, you won't be suffering from many of the diseases as it will go, as you will grow older. Up to 30, kuch nahi hota, right? Usually. Now, even heart attacks and everything has become so common. But it is all because of wrong techniques, right? There is one very major race coming up, right? I just registered for it. It is on 9th November. It is 32-kilometer trail running, on which you have to run on mountains, you have to go swim through the river and all those things. And the cutoff time is 5 hours. So within 5 hours, you have to finish this 32-kilometer. Very tough race because it is by ITRA, right? International Trail Running Association. The moment you complete this race, your name starts coming. This is an international organization, so they register you and your name starts appearing on their website. So one of the very tough race. So for any of such things, you have to train your exercise, define your exercise in a way that you are going for the specific muscles, and it becomes a pleasure. All right. Here. So this is deltoid, we know that. Pectoralis major, know that. There is a space, right? You can feel that space. So what you have to do, make the deltoid prominent, head it like this, and then the space. And when you take your hand back, you'll feel that there is a groove, right? There is a groove. That groove, which is between pectoralis major and the deltoid, and then there is that small space, right? This is what is to be felt, right? This is what is to be felt. Deltopectoral fossa. right, or the groove. Why studying this? Because later on we'll find that what are the structures which are passing through it. Because se kisi ne chura mara, thak, right? So then just from the injury, we should be able to judge that what is expected. Why is his hand is like this? So that means brachial plexus is injured, right? What is the shape of his hand? What is the position of his hand? Accordingly, we can decide before even CT scan that which vessels and which nerves they are injured. Right? This is how the real muscles they will look like. So that's our humerus. This is the scapula, and this is the pectoralis major. In pectoralis major, because it is connected with rest of the clavicle and the sternum, right? Clavicle and the sternum. So here it is connected, and then it straight away reaches to the humerus. That means in between, it bypasses the scapula. That's why it has got a wide range of movement. This is platysma. Platysma is subcutaneous muscle. So when someone बहुत गुस्सा होते हैं तो that like hunk, right? So it contracts. So this is the platysma, which is a subcutaneous muscle. Pectoralis major, so now you know it very well. From this point onwards, we'll be writing it like P major or packed mage. Like packed major, pectoralis major. Because major लिखा है तो minor आने वाला है. Then its shape would be pretty similar. So here it is, as it is pectoralis major and it is connected to the arm, that is humerus. Humerus is the bone. So when hand is like that and this muscle contracts, so it will take the hand near, right? When the hand is coming near to the body, it is called as add. It is adding.
Adduction.
Adduction. That's right. It is called as adduction. Okay. So that's the platysma, right? This is a subcutaneous muscle which is spread across. मतलब जब बोलते हैं नहीं, right? So that thing, so this is when it is contracted. Yes, I'll kill. तो बस तब ये this is contracted. It is to मतलब this is a muscle of anger. So simple यार. बहुत गुस्सा है ना तब समझना कि this is the muscle which is contracting. So जब तक जहाँ तक possible हो, don't use this muscle. Okay, so this is clavicle, that's the deltoid, pectoralis major, pectoralis minor कहाँ गया? So that's why question mark. Let's find it. Right. So here it is. This is just a sort of revision, right? Acromioclavicular joint. ये तो बात हो गई. We know that thing very well. And then that's the scapula. This is the humerus. All good. But ये कौन? Who is this? This is one another protrusion. That's right. That is the coracoid process. This is the coracoid process. Cora means crow-like. कौवे की चोंच. पता नहीं. When last batch they said सफेद कौवा, right? So that's what they said. So this is coracoid process. It is a crow-like, beak of crow, right? Beak of crow. So that is the coracoid process. Very important because this is a small space, but on small space, all big Maharati muscles, they will be coming and landing over here.
Muscle attachment.
Right, for the muscle attachments, right? The advantage is because it is connected at one point. So all those muscles, they will be giving the strength to that point and then pulling it. Right, so this gives tremendous mechanical advantage. So how good must the God be in physics? This is our top view. Now we are summarizing everything. This is the top view, right? When we watch it from the top, so this is the clavicle which is in front. Okay, right? That's the clavicle. Okay, and that's the acromion process, right? So it is connected. And this acromion, this is the figure for which I was waiting. This is the point. This is the spine of the scapula, palpable on back side. So when you put your hand, right? Put your hand and then you'll find. And then you can trace all the way from here till pura forward. मतलब you trace it, and then यहाँ पे जो फूल हुआ, top. Your top is what? This is the acromion process, a flat process. And then it continues further in the form of clavicle, right? So this entire ring is palpable. Clavicle is palpable, acromion process is palpable, and the spine of scapula is palpable. इसीलिए when the weight is to be lifted, right? So why this is take it on shoulder. So for example, if you are using a rifle, So you put the rifle over here, right? Rifle over here. So this is where there is bone, right? Multiple bones, right? Along with the stabilizer muscles, and this deltoid is acting as a cushion, because when the rifle fires, right, so there is the back thrust. Now that thrust is pretty powerful depending upon the bore of the that bullet and how much thrust it is generating. And so either you are holding it over here or you have to hold it down. But in that case, your shoulder should be tucked onto the abdomen, and then your hands, they are taking the entire pressure. Okay? Yes, that is part of the forensic medicine. It will come. So this is now spine is clear to us. The area which is above, it is called as supra, right? And the area which is below, it is called as infraspinatus. So supraspinatus, infraspinatus. This is above, this is below, right? No big rocket science, simple supraspinatus, infraspinatus. Areas के नाम है, right? So this is the deltoid, right? Now that's the spine. यहाँ पे we have written the spine. So invariably we know that we are now watching from the back. This is the back side. Okay? Then and then we'll be able to see the spine. The muscle which is over here, this one, right? This one. This is called as trapezius. Trapezius means it is like a patang, right? Kite. So that's the kite, right? Now this is the muscle. This is trapezius. So your uppercuts, right? So this is the head and this portion, this and this. So that is thanks to the trapezius. And then it forms the back, right? So when we combine both the sides, right and left, so it becomes like a trapezoid. It is called as the trapezoid, a shape, geometrical shape, right? Or easy to remember, it's like kite. So that's how it really looks like. Real image. Right? Real image. Muscles, they look like this. Now comes the concept. Such concepts, they will be coming again and again into almost the entire anatomy. This is like a trailer, right? That is where the visualization is important. Visualization means, as such, if we say that there is a pyramidal shape, we'll say ki wo kya, right? But just take your hand like this and touch onto your axilla. Are you finding there is a depression? Your hand will go inside, right? Your hand will go inside. That is the axilla. That is a space, right? And in that space, some important structures are there. That's why it is important to know that axilla. That is what is called as the armpit, right? Armpit or the axilla. Now for this axilla, let's see how it is formed. Without any knowledge, right? Kuch soche bagair. So let's say we want to form it over here. This is the right side. This is the right side of the body which we are talking about, right? So just draw it over here. From front, right, there is one muscle. So that would be pectoralis major, no doubt about it. Easy, you know. Then there would be some muscle which, the way this is anterior. So then there has to be some muscle which is on the posterior side. So wo posterior muscle, right? This posterior muscle. That would be latissimus dorsi. That would be, wait, right now we don't take the name, right? So there must be some muscle. And then there will be some muscle which will be in between, right? So thus we have got three muscles with us, right? Three walls with us. So pectoralis major, anterior. Itna clear. We need to find out this. We need to find out this, right? And hand is over here, right? Hand is over here. So that would be the lateral wall. That would be the lateral. So yeah, this is like a potential space. This is like this space which is in between, right? Then the skin comes, it covers. But yes, the moment you take your hand like this, and then you'll find that yes, there is a space, right? That is what is called as the axilla. That is called as the axilla. It's a pyramid space, right? So we know now the deltoid, we know pectoralis major, And the muscle which is giving then that V shape to the body, V shape, right? This is called as the latissimus dorsi. Latissimus dorsi, right? So uppercut, this is by trapezius. That trapezius would go like this, right? And this is the, so this is the traps, that is the trapezius, and this is the lats, that is the latissimus dorsi, right? So this latissimus dorsi is a posterior part, So that's latissimus dorsi. So we have got anterior wall by pectoralis major and the posterior wall by the latissimus dorsi, right? The only thing which is left out is in beach mein kaun? Beach mein. So that beach mein is another muscle which is
Anterior.
serratus anterior.
Serratus.
Serratus, so this is like serrations. Serrations means आरी की तरह. Its look would be like that, right? So it is serratus anterior. मतलब posterior भी होता है, हाँ posterior भी होता है. That's why इसको नाम anterior दिया. So thus we know now three things. Let's see it quickly. So this is a real image, right? And we see it over here. So that's the latissimus dorsi, right? That's the latissimus dorsi highlighted. This one is pectoralis major, right? And see, this is the space which we are talking about. This is the axilla. ठीक? And in axilla, ये दिख रहा है एक मसल ऐसे है, right? You can see that. So अभी और आगे आएंगे, right? But this is the space which we are talking about. Right? So that's the axilla. And these muscles, they are the serratus anterior, right? Highlighted over here. That's the serratus. Serratus anterior. Serratus anterior is also a very smart muscle, very smart. So now things are clear. On the medial side, we have got on the medial wall, we have got this serratus anterior, right? And it has got 8 parts. Now, you ask that in some of the books it is written as 9 parts. Yes, possible, right? It varies from 8 to 9. But in these 8 parts, it will give you the complete summary because there is a specialty about it. 1, 2, 3, they will be carrying the weight. And 4 to 8, they will be, their function is to keep the scapula near. Right? Keep the scapula near. Abhi just wait for 10-15 minutes and we'll be talking about it in more detail. 9th, if present, it is supportive. So all these things now fully known to you. Biceps, yes, you know. Sorry, deltoid, you know it, right? Pectoralis major, this is the packed major, you know that. But here we have cut this upper part, right? We have cut this upper part, upper ka part cut kiya. And that upper part is cut. So suddenly we are watching some other muscles, right? There is one muscle like this, right? Then there is one muscle like this. And this is something which we have already marked, right? This yellow color. This is the biceps, right? So biceps has got 2 heads, short head and long head. Short head matlab, it is traveling less, and long head, it will be traveling so much, right? So that is a long head and this is short head. Short head is going where? To that new process, coracoid process.
Coracoid process.
That's right. It will be going to coracoid process, right? So this is the short head of biceps. Bi means 2, right? Bi means 2. So it has got seps means head. So there is a long head and a short head. Right? Big muscle, the biceps, all those dole shole, they are actually this, right? So this short head biceps, we just cut this short head biceps, and there is one muscle which is smaller, which is underneath, right? And this is called as the coracobrachialis. So this means this muscle is also going to the coracoid process. Very right. This is coracoid process and brachialis. Brachialis means it is going to arm. Arm means what? Humerus. There is only one bone in the arm and that is humerus. So it is going from humerus to coracoid process and that's why it is a coracobrachialis. See the name so conveniently gives coracobrachialis, right? That is good. Here, this is the indication that we have cut short head of bicep. So whenever will be in our this notes, you'll find this. This means that particular portion has been cut and we are watching the things which are just underneath. Okay, so this is through now. Pectoralis major. Pectoralis major, we know that it is this bone, right? And there are 8 slips. And what we are watching is the first 4 for these serratus anterior. Right? These first 4 slips or the first 4 part, they are making the medial wall of axilla. Right? Anterior wall made by pectoralis major, posterior made by latissimus dorsi.
Latissimus
Medial
dorsi.
it is made by the axilla. Huh? Written parcel? Huh? Just excuse me, just in a minute, I'll be back. Just a minute. Sorry. So these top 4, right? Top 4, they will be making the medial wall of axilla. So now you know the axilla pretty well. Anterior portion, pectoralis major, posterior portion, latissimus dorsi, medial wall, serratus anterior, top 4. Easiest part, that's the clavicle. You know it so well. And this clavicle, just underneath this muscle, there is muscle which is just underneath, just below. And this muscle is called as the subclavius. Subclavius, which is under the clavicle. So that is subclavius. What it will do, it will support arteries and nerves. Because this is the small muscle, right? But it will be giving a base on which the arteries and the vessels, nerves will be lying. Important is brachial plexus. Brachial plexus will be one of the major topic. Brachial means arm. Plexus means group of nerves. Those group of nerves which will be going in a very royal way and they'll be supplying the entire upper limb. So that is the brachial plexus. One of the most important topic for the upper limb from the perspective of clinics, viva, real exam, everything, right? So subclavius, though small, right? But its importance is that much. And here comes our pectoralis minor, right? Its shape is very similar to pectoralis major, but it's ka chota bhai. That is the pectoralis minor, landing on that favorite coracoid process. Right? So we have got the coracobrachialis. Now this is coracobrachialis, and we have got the pectoralis minor, both of them landing onto the coracoid process. Sorry. Again, we have removed we have removed pectoralis major, we have removed pectoralis, right? Pact major, that is removed. We have removed the pectoralis minor, that has been removed. So our entire focus now, see, छोटा सा छुप के ये छोटा सा मसल दिख रहा है. Which muscle is this?
Brachioradialis.
Brachioradialis. तो मेरे दोस्त radialis यहाँ पे आया, right?
Sorry.
Coracobrachialis.
Coracobrachialis.
I know that your intention was to say coracobrachialis.
Yes, sir.
Right. So that is there. But this is just to show this is the short head of biceps and this is the long head of biceps. The reason why we say that it is a long head because it travels long. ये तो जाके coracobrachialis पे जाके बैठ गया, right? So that's why it is a short. This long one, it actually passes between what is called as the, over here,
Epicondyles.
नहीं, ये
Occipital
क्या
groove.
था? ये क्या
Occipital
था?
groove.
What was this?
Bicipital groove.
Bicipital groove.
Bicipital groove.
Tubercle.
Yes, it
Sulcus.
is also called as
Intertubercle
the
sulcus.
Tubercle.
intertubercular sulcus, right? So greater tubercle, lesser tubercle, in between it is, that was a groove, and that is the groove for the long head of biceps,
Bicep.
right? The interesting part is कि अब तो ये पूरा head आ गया ना, यहाँ पे तो shoulder joint बनेगा. Yes, because that's the reason that this long head, it actually passes into the shoulder joint. Right, it penetrates the synovial capsule and it goes inside and then it lands, right? So it travels that much. So during our dissection, we'll actually see this thing in more detail. But here it is, right? This is travel. So ribs, right? So these are the ribs, these are the ribs, these are the ribs. This is our serratus anterior, right? And in between the ribs, in between the ribs, we have got the muscles. इसका नाम क्या दे? They are called as the costas, right? Because we are using Greek and Latin. किसी को समझना है इसलिए, right? Ribs बोले तो inter rib muscle तो कुछ मजा नहीं आया ना. But when you say,
Intercostal.
हाँ, intercostal muscle, so it looks
Intercostal.
aggressive, right? So that's why it is called as the intercostal muscles. Now
Sir,
there
to
are
be
three.
precise, they are external intercostals, right?
Exactly. External intercostal, because there would be like internal intercostal also. And the beauty of that is that those muscles, they are like this. They are like this, right? One is in this direction, second one is in this direction, deviating slightly. When the waterproofing was to be done, so I said that, say, for the waterproofing, right? Mistri kaise lagate, brush layer, right? They just apply the whole coat. I say it is useless. Don't do like this. First, apply the coat of that waterproofing material like this, right? The brush should be moving in one direction. And then the second coat which is to be applied, it should move in this direction. This gives the best waterproofing, right? Same principle, right? Same principle of that of intercostal. When the muscles, they are at 90 degrees to each other, they give complete and full protection, right? So same here.
Like polarizer,
Hmm?
light polarizer, like.
Light polarization, that is because of, say, its principle is when you want to let pass only one frequency of light, right? Because light is made up of multiple frequencies. With a polarizer, it is blocking all other lights, right? And only a specific frequency of light is passing. So that is where, when the polarizers are used. The biggest use of polarized lenses is what? Biggest use.
To
It's
reduce intensity.
नहीं वो तो ठीक है. Spies, they use it for what purpose? Polarizer lenses are used. You are spying on someone, right? You have got the camera and you are watching. ठीक है? If there is no polarizer lens, तो सामने वाला गाड़ी में बैठा है,
Reflection,
नहीं दिखेगा.
reflection,
नहीं deflection नहीं. The thing is,
reflection of
reflection,
the
हाँ,
light.
but say this is a car, right? And this is a windshield. यहाँ पे सूरज है, अंदर they are sitting, you won't be able to see that. But the moment you adjust the polarizer lens, it will cut off rest of the lenses and you'll be able to see this person specifically, because the rest of the lights which were distracting it, they are cut. And now you are watching pinpoint the frequency which you want to see, right? It is one of the biggest reasons. Just try it once, right? And you will be surprised कि क्या clarity से दिखते हैं अंदर.
Sir, polarizer is quite expensive.
Yeah, it is expensive. I'll show you. Don't worry. We used this polarized lens to spot the cheetah when we were in Africa. When I was with National Geographic people, we were over there stationed for about 3 weeks in Masai Mara. I'll show you the pictures. So this is the, let's move further. Over here, easy, biceps. This is the short head of biceps, long head of biceps. And this is also called as the bicipital groove, right? This portion, it is also called as the bicipital groove. You say that. And that's the coracobrachialis, because this is the point where we have removed the short head of biceps. Correct? So short head biceps has been removed. So that's a long head, coracobrachialis. right? All clear, all clear. So just a sort of revision, anterior is pectoralis major, posterior is latissimus dorsi, and that's the axilla which we are talking about. And this one is the big artery which is flowing, the huge artery, right? The main artery, and this artery is called as the axillary artery. It is the axillary artery which will be changing its name to brachial artery,
Brachial.
right? So this is the axilla, right? Axilla is armpit. So when that artery is going over there, we say it axillary artery. Importance of axillary artery is that there will be the cords which are the part of brachial plexus, they will be surrounding it. So when we say posterior cord, तो posterior कैसे बोला? With respect to axillary artery. So a nerve which is behind the axillary artery, we'll call it posterior cord. Nerve which is medial, so we'll call it medial. Nerve which is lateral, we'll call it lateral. Right? So medial cord, lateral cord, posterior cord, they are all with respect to axillary artery.
Sir,
And
bunch of
that is,
nerves is plexus.
sorry?
Bunch of nerves is called plexus.
Bunch of nerve is called as the plexus, but they are like end nerves. Now these are the roots, right? So that's why when we'll be learning brachial plexus, so we'll be following this. Well, this is how we used to remember. Ram, to, dur, chala. Right? So that means root, trunk, roots they make trunk, trunks they make division, and divisions they unite to form cords. Now, interestingly, someone said कि नहीं sir, अब तो हम अलग ढंग से याद रखते हैं. And that was remember to drink cold beer. मैंने कहा ठीक है. Right? But this is how we used to remember. Ram to dur chala. So this is root, trunk, division, cord. And then roots, yes, roots, they combine to form trunk. Trunks, they combine to form division. Division, divide. Anterior, posterior, anterior, posterior, anterior, posterior. And then those divisions unite to form cords. And from cords, there are the branches. This is like a wonderful, beautiful circuit. If you remember this circuit, right? So even यहाँ पे say for example there is a tube light, so that tube light is not working, so इसका wire कहाँ से कहाँ जा रहा है, बस that is how you will be learning the entire nervous system of the upper leg. So whenever we'll be discussing कि कोई कहेगा यार मुझे यहाँ पे दर्द हो रहा है उंगली में, तो then we trace all the way in our mind, right? So that we know that कहीं ना कहीं compression आ रहा होगा. Still important when people say अरे मेरा, right? People say कि there is sciatica, you have heard of sciatic pain, right? Back में pain हो रहा है, hip region में, and that pain is traveling all the way down.
Yes.
So common, right? And then being a medico, what will you do? You'll find just from the clinical symptoms that where could be the compression, the commonest area where could be the compression. If you do such exercises by which that compression is released, you'll find that patient within minutes will say, "Ha, finding it so comfortable," right? So that's the importance of radiology. Anatomy. You go to radiology, you go for CT scan, MRI, and then it is said, "Arey, there is a compression of the disc between L4 and L5 and L3 and L4." अरे वो तो ठीक है, right? But clinically, you will always try to figure it out that where could be the problem. And these are the foundation, these are the basics, right? So this is the axillary artery. और आगे चलते हैं, right? Here it is. In previous image, axillary, those plexuses or those cords, they were removed. Now see these are, right? These are the brachial plexus components. These are the brachial plexus components. See all these cords, right? These are all. So they will be round surrounding it. And here it is. देखो, which muscle is this?
Brachialis.
Subclavius.
Sorry, subclavius.
ये अपना clavicle
Subclavius.
यार. Right? ये clavicle, and see that clavicle, that subclavius is supporting these vessels. So that's the reason it supports vessels, blood vessels and the nerves. Right? Because hand will be moving so fast. So this thing should not be damaged. So that's why this gives a support. So here is now pectoralis major, totally isolated. So pectoralis major is connected all the way. Upper clavicle, medial 2/3, big area, right? Medial 2/3. You can even palpate it, medial 2/3, right? How to find that? These are the nerves. These are the muscle fibers which are superficial. So just put your hand like this and take the hand inside, right? Inside. This is the adduction, and you'll find such a prominent, right? That muscle will become so prominent. You feel it, right? So you are contracting this group, the clavicular fibers of pectoralis major, right? Clavicular fibers of pectoralis major, which are connected to the up 2/3, medial 2/3 of the clavicle, right? Or the clavicular fibers. So that's the pectoralis major. Lower fibers, they are going all the way to sternum and to the sixth costal cartilage. Now, you know sixth costal cartilage, right? The game will end on the seventh, because from 8th they will be connecting to the costal cartilage of 7th. So यहाँ पे 6 costal cartilage. So all the way it is covering almost the entire chest. So that's why this pectoralis major is so powerful, right? It has got a wide connection. From the female perspective, right? It is always said, right? After certain age, female, they start losing the beauty in the form of that the breast that starts sagging. Now, this entire thing is on this pectoralis major. When the base becomes weak, so that starts all those effects. Obviously, there are other reasons also, like those fibers, they become weak, etc. But again, if from the male perspective, if you want to develop your good chest, so then from the female perspective, your beauty is also important. That's the reason that this muscle plays a vital role. If this muscle is sagging means dhila dhala muscle, so yes, the base itself is weak and it will tarnish the beauty of the female, right? No doubt, external beauty, but still it is important, right? But those exercise, when you are in the best years of your life, when the muscle power is good, right? Then just spending 3 minutes a day, why not, right? If these Hollywood, Bollywood females, if they are doing, so then why not you? Right? उसमें क्या? Other people say कि अरे आप क्या स्टाइल मारना? Especially when they say कि अब तो शादी हो गई, अब क्या? अरे boss, even when you reach to the age of 70, still you should be looking amazing. So this is the close focus of, these are the fibers. These are the fibers. Sorry. Yeah. These are the fibers. These are the clavicular fibers. And see the clavicular fibers, they are landing, going down, right? They are going down. Ab kahan gaye wo fibers? Here it is. They are folding and then finally they are getting connected, right? So it is like this is a fan and it folds and it gets connected. Two effects. Can you guess the fiber which is folded and then it is getting connected onto the humerus? So when it contracts, it will pull the head arm towards the chest. Adduction, correct? Adduction. So that's how. So that's how it takes. So bicipital groove we know. So this is the bicipital groove, right? This is the bicipital groove. This is the bicipital groove. Wait. This is the bicipital groove. So when we have got this groove, so then this is the outer lip, this is the inner lip, and this is the in-between area. In-between area, to theek hai, we know that it is the long head of biceps is going. But that's the lateral lip and this is the medial lip, right? So for this intertubercular sulcus, it is the lateral lip. That's where the pectoralis major lands, right? So it is the lateral lip of bicipital groove. That's where it lands. Right? So these are, so now we have come to this conclusion that there are two layers of pectoralis major. One layer which is superficial, second layer which is deep. Superficial layer which is anterior, right? So this shows this is anterior. And then it winds around, but ye posterior, because these fibers, they are behind, right? So these fibers, they are front. And these fibers which are coming from the sternal area, they are behind. So we say they are posterior. This is superficial and these are deep. Superficial, they are coming from clavicle and this is from manubrium sternum. Right? Good. This is how we have removed everything and now we are watching from the back and this is the posterior side. So here, pectoralis major. This is in nutshell. There is anterior lamina, posterior lamina. Lamina means layer. Lamina means layer. Right? So this is anterior lamina, anterior layer. It is by superficial and deep. Superficial from clavicle. Deep is from manubrium sternum. And posterior lamina, it is from 2 to 6 costal cartilage. Right? You remember we said that on 6 costal cartilage it ends. Done. So this you need to remember. Right? As such, not very complicated, but this was the most important point for today. Understanding how the pectoralis major. From this point onwards,
Sir,
it's
can you repeat the
Sure.
lamina and all this?
Anterior lamina, posterior lamina. Anterior lamina is what from anterior what you watch, right? So if you remove the skin, so the muscle which is watched is the anterior lamina or the anterior layer. Anterior layer is divided into 2 parts. One part which is coming from clavicle. Second part which is coming all the way from manubrium sternum, right?
Yes,
This
sir.
superficial part is the clavicular part. And this deep part is the sternal part. So that anterior layer is complete. But if you watch it from the back, so there is a posterior layer also. So thus this muscle can work in 3 ways. 3 ways. It has got 3 group of muscles. So that's why its action would be multiple. Right? So this posterior lamina, these fibers, they are connected from 2nd to 6th costal cartilage. Right? Costal cartilage. So
Okay.
that's this pectoralis major. So here it is. This is pectoralis major. It has got nerve supply, medial and lateral pectoral nerve. Medial and lateral pectoral nerve. So medial and lateral pectoral nerve कहाँ से आई? Brachial plexus के part है. Right? Obviously, the thing is, remember this. The nerve which is near to the organ or nerve which is near to the muscle will supply. Only there are few exceptions, right? But in most of the cases, it would be like that only. Sometimes it happens that kisi nerve ki bahut ichha, it will be traveling so long and then it will supply that particular muscle. But there is a big khatra in that. Right? We are just now discussing in a minute about it. Right? So this is the nerve supply, which we say. So here it is. Now regarding this clavicular part. So clavicular part, they are above, right? So when it contracts, when it contracts, right, it is like horizontal fibers, right? So when it contracts, so it is going for the adduction. But adduction to मतलब हाथ ऊपर है, नीचे है, कहीं पे भी. No, but this is the transverse adduction. So in gym, when you do like this, right? So that is where you are deploying these clavicular fibers. You are deploying these clavicular fibers. This is what you do. Back deck, right? Clavicular fibers. Now in gym, again, from the fitness perspective, when you are using machines, so that machine is going to operate exactly in a very synchronized way. Now, same thing if you go for the dumbbells, right? Now they are called as the free weights. Even with free weights, you decrease the weight, but when you do it, because it is free weight, that's why the chances you have to keep on balancing yourself. So it is where the brain is also involved. In machines, this thing will not happen, right? You don't have to pay so much of attention. So that is the difference between machine and the free weights. But machines are safe. You can increase the weight. Once the power is developed, you can even shift to free weights. Okay. So this is one. Now, because these fibers, they twist and then they attach, right? These fibers, they twist. So that's why when they contract, they can even go for the medial rotation. Right? So that is the medial rotation of the arm. So this is a complete. Now we are watching from the back side. We are watching from the back side. This is spine, right? And here it is the latissimus dorsi, lats, which is giving that V-shaped cut, correct? On the anterior side, we got that pectoralis major, which is on the anterior side. That's the deltoid, you know that. So pectoralis major, latissimus dorsi, and this is the teres major. This is the teres major, right? Another muscle, which is the teres major. So here, on the lateral lip, there is pectoralis major. On the medial lip, there is teres major. And in between space, it is the latissimus dorsi which is getting connected, right? So in that much space, these three are connected, and on top of it, it is that long head which is passing, right? So in order to remember this, it is like lady between two majors. That's how, right? Very, see, effectively one can remember. So it is this latissimus dorsi, which is sitting between this pectoralis major and the teres major. So that's the clavicular head fibers. We saw that, right? And over here, in case of upper limb, there is always the mobility is important against the stability, right? Mobility is more important. So that's why this glenoid cavity is very shallow, right? It is shallow. So on that shallow cavity, the head is moving. So that's why we get so much of mobility. In case of lower limb, it is that stability is important. So that's why the head, it really goes into the acetabular cavity. So here it is, that glenoid cavity, which is pretty shallow. Right? So this is when we move. There is so much, such a big range. Our hand, they can move like this, not our legs. Another trapezius and the pectoralis major. So when the head is up, then it goes down, right? It is called as shoulder depression. Shoulder depression, the real muscle. From the side, we are watching pectoralis major, anterior, right? Latissimus dorsi, posterior. And here is in the axilla serratus anterior we are watching, right? So hand is up, and as if we are watching from the side, and we get this complete clarity.
Sir,
and
where
this
is
portion.
teres major?
Teres major is not seen over here, right? Teres major will be, because it will be seen. See, I'll show
It's
you.
under trapezium.
It is here to remove those muscles. Right? Here it is. See, right? Teres major is on the back side. What we are watching is
Lateral
this
side.
portion, correct? This portion, axilla.
Sir, teres minor.
So this is like teres major, which is present over here. And this is the axilla, that is the latissimus dorsi, that's the pectoralis major. Right. This is one more muscle which we saw. This is the coracobrachialis, and see over here, coracoid process and the humerus. That is how it is connected. Coracobrachialis. That's the pectoralis minor, and here it is the teres major. Now seen more clearly, right? Teres major. Teres major, when we'll be learning scapula, at that point I'll show you full teres major, right? Right now it is pretty covered. You have to remove so many other muscles to see it properly. But pectoralis minor, no doubt about it. Pectoralis minor plays one important role, and it is that it draws scapula forward, right? It draws scapula forward. But it is scapula is not connected as such, if you see, with the thorax. Scapula is connected with the body via this glenoid cavity and this joint, right? So this body of the scapula, it can go back So it is the serratus anterior which is pulling, which is keeping the scapula near the body. So serratus anterior keeps scapula near body, near the body. So that's the whole idea, right? So that is now latissimus dorsi. We have removed other muscles, so we can see this pectoralis major. Coracobrachialis is just, this is the coracoid process. So that is the coracoid process and the latissimus dorsi. And here it is, the serratus anterior we have kept, and this is the axillary artery, right? This is the axillary artery which is going all the way, and then we are telling it a brachial artery. At what point it happens that now we start calling axillary as brachial? It is this importance of teres major. The lower border of teres major, till that point, we call it axillary. From lower border of teres major crossed. So that is the brachial artery. So this is the LOC, right? So before that and after that, the border changes, name changes. So that's serratus anterior. There are 8 strips. The tops, they are connected with the scapula, right? So that's the reason its function is to keep the scapula near the body. Top 3, right? Top 3, they are having weight carrying function. So whenever you lift heavy weights, right? So you will also be raising the scapula. You will be raising the scapula thanks to these top 3. Right? Because they know that once the scapula is stabilized, the entire weight would be transmitted via clavicle onto the central axis. So this is on the medial border of the scapula, it will lift, right? Weight carrying. Now, if this is a surface, if this is put near the body, then the lower portion that will move away. Hai na? If you just, this is the scapula, you just make this thing tight to this lower border will move, lower surface of the scapula will move away. So 4 and 8, they keep scapula near the body. That's the whole function. So,
Sir? So the first one is attached to the root or what? Like the second and third and then the fourth and eighth. It is like in section.
in sections.
The first one is attached to the root.
That's right.
Oh.
That's right. First one is attached to the root. But the function is like this, right? 1, 2, 3 and 4 to 8. So this keeps scapula near the body 4 to 8. And this is what we are very much interested in. Now here is, this is the picture. In between, this is prominence, right? So obviously the clavicle is broken and clavicular shaft is what we see. See over here, this was the image which was shown even previously also clearly, right? The clavicle is broken and the broken bone has been shifted. This is fractured clavicle. Fracture can be open or close. Open means when the skin is broken. Right? Close means when skin is not broken. This is X-ray. This is a radiograph. So over here. Simple fracture is when the bone is broken, right? Skin is intact and it is in just 2 pieces, but simple. And when it is having multiple pieces, when the bone is badly broken, I mean, then there are some fragments over here, right? And then, so such fracture, they are called as the comminuted fracture. Comminuted means multiple pieces. When there are multiple pieces, there is no other option but to go for surgery. When this is a simple fracture, the bone has just broken, so you can put those broken ends together, and that is called as reduction. It is called as reduction. Reduction means putting the broken pieces together, then the nature is there, which will heal everything. It will join both the things, right? But when there are multiple fractures, multiple pieces, then it is comminuted. In comminuted, you have to open the bone. So that is, this is called as a reduction. Over here, easy to understand, right? See how the fracture is there, clavicular fracture, right? Acromion end is seen. See, it is totally displaced, right? Totally displaced. Now this is serratus anterior. Regarding the serratus anterior, This is supplied by long thoracic nerve. The name itself is long thoracic nerve because it is pretty long. It starts from the spine and all the way it comes over here to supply. That's the reason that chances of getting this nerve damaged, they are very high. When this nerve is damaged, serratus anterior is paralyzed. When serratus anterior is paralyzed, the main function of serratus anterior is to keep the scapula near the body. Now it cannot keep it near the body. So that's why when you push, right, when you tell the patient to push, the scapula would not be able to stay near the body. It would be winged. Why winged? Because this is what really happens, right? It is these muscles. Serratus anterior is not working, so it is unable to keep the scapula near the body, so it would wing, right? Will he be able to carry the same weight? No, carrying of the weight will also be affected. But this is the sign which is easily seen, right? Because we are not knowing that how much weight he was lifting previously. So this is what is called as the winging of scapula. So that's a long thoracic nerve affected by knife attack and massive intensive radiotherapy. Just a minute. One call is from the family is coming again and again. Is everything okay? Just give me a second. Sorry. So this is like a knife attack, or when there is radiotherapy. So in radiotherapy, nerves are affected, right? So if this goes wrong, this is what is called as the winging of scapula. Here it is. This is sternoclavicular joint dislocated. So this is like a sternum clavicle when this joint is dislocated. So because these are the joints, right? When that comes out of capsule, so this is the dislocation. Now person's hand would be like this, right? Because this is dislocated. So now clavicle is no longer connected with that central bone. So this is the dislocation, right? Similarly, more common is the anterior dislocation at the shoulder, right? At the shoulder. So this is most common. So here it is. Watch for this.
So shoulder dislocation is treated even without surgery, right?
Yes,
Like
that is what is
just
called as the Kocher's method. Now here it is when the X-ray is taken. This is the glenoid cavity, right? And this one is the head of the humerus, right? You can immediately see that the head of humerus, it has come out of the glenoid cavity, and this is the situation. This is how it is looking like, right? So this is the shoulder dislocation. In order to treat this is what is called as the Kocher's method. One should really know, but it is very easy to understand. So now with this much knowledge, you'll be able to even treat the patient. For the Kocher's method, now this is the shoulder, it is dislocated. The first thing which you will do is arm adducted. So consider this is dislocated. So arm adducted. Now this is, say for example, I'm a patient. So then you'll hold my hand and arm adducted. Now, when the arm is adducted, right? When the arm is adducted, so this is the first point. Then bend the elbow, right? Bend the elbow and elbow in sagittal plane. What is sagittal plane? This is the sagittal plane. You will be taking the elbow away, right? You have to do this thing along with me. So this is when the arm you have taken, right? Adduction, bend the elbow, and then take the elbow away. Now this is in sagittal plane, right? So in sagittal plane, this is the coronal plane. So and this is the sagittal, in sagittal plane. So you will do this, and then you will take the elbow in front, right? Sagittal plane is this. So you'll take the elbow in front. So when you do this, elbow in front, and then there has to be, right? So elbow in front, and then internal rotation. The whole process goes like arm adducted, elbow front, and the internal rotation, and it will slip back into the glenoid cavity, right? This is Kocher's method. Very, very important method. One must know. So that's it for today, right? And this file you can even download from that location also, right? In the YouTube. In the YouTube, right? This is the channel name, same my name, right? And then this is where you go. And then you go to playlist. In the playlist, you'll find anatomy, upper limb. Anatomy, upper limb, right? And in that, this is the first lecture, that is the pectoral region. So, and in the description, there is a link, that is a Google link, that is another Google link from where you can download all the PDFs. It is just one link and you can download all the PDFs together, right? You can just download all the PDFs of upper limb in a single shot, correct? So do that. So that way you will always be having the entire material. Another thing is, say one comment which came. Serratus major a subscapular muscle or it is a serratus minor? No. Currently, see, it is not serratus major, right? It is serratus anterior, right? Serratus
Yeah,
anterior.
serratus anterior, sorry.
Serratus anterior. Align cartilage, that's right.
Sir,
Acha.
Then is it serratus posterior that is
there is serratus
subscapular?
posterior. There is serratus posterior superior, serratus posterior inferior.
Okay.
Right. So
It's quite complicated.
So that's why I'm taking. Another thing, the thing is that's a question which was asked, why there are only 8.5K subscribers onto your channel. Well, because I never say that you subscribe and then you comment on that. That's why even in all of the videos, last comment which was about 4 years back, right? So that's why channel never becomes that popular. It happens. So yes, at least I can tell you, do write something into that, because people don't usually write it in comments. So do write anything, whatever you like. But yeah, it makes a difference. So the thing is, on that link, today only, you will download all the PDFs together. So every time you don't have to download, right? And I'm saving this PDF, but because it is one and the same, no, chalo, I'll upload it to our shared folder also. Just for the reference, you can keep both of them. All right. So day after tomorrow, we'll be going with the second lecture into that list, right? Meantime, revise this thing in the way we talked about today. Before sleep, you will revise it. Today morning, when you wake up, right? After you wake up, revise it and see the difference.
sir.
Huh?
Sir, now the pectoralis minor also contributes in keeping scapula near the body, right? So in winging of scapula, why can't it help at least a little bit?
It helps. It helps, definitely.
But it helps, but pulley-like action is occurring,
exactly.
right?
The percentage, that is when we'll be discussing that specific movement in kinesiology, that is the pectoralis minor and the serratus anterior. Serratus anterior's role in keeping the scapula near the body is 85%. And this bichara is just 15%.
Sir, also due to its pulling towards the front side, it wings even more, right?
Yes. Because this is pectoralis minor's real function is the diversion, right? How it really diverts that pressure, right? But serratus anterior, it is bilkul raw. Its function is just to keep it near, Right? So that's why it is affected. Not
Okay,
my
sir.
question. All right. Thank you and take care.
Thank you, sir.
Thank you,
Thank
sir.
you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
sir.
Uh,
Thank you, sir.
yes, someone is asking. Okay. Chalo. Take care. See you soon.
Thank you, sir.
Thank you.
Thanks a lot.